I'm Sister Jacinta Njoki, Administrator at St. Joseph Health Center, Ngando. My work basically is the administration, but I'm a nurse by profession. We were screening hypertension, diabetes. We were checking out on mental health issues. We are checking out on cancers, particularly the cervical cancer, breast cancer, and for the male, the prostate cancers. And a lot on health information on all the lifestyle changes, nutrition, diet, and it has been of great impact to the community, because there are those who are there with the illnesses but they were not diagnosed. Since most of these have no initial signs, just a headache, people will take it to be just a normal headache, so they never went for intervention or for checkups. Just maybe a small breast lump, nobody will take it, it goes unnoticed. But through the screening, we have had to refer some for further diagnosis and treatment. And there are those we have been able to roll up for our program in the treatment. And not only the treatment, but the monthly clinics where they come, they advise, they get health talk, they interact with each other. They know what is the way forward, or how they can manage and contain their maybe disease like hypertension or diabetes, which is controlled. So the positive thing is that we have seen them reaching to a controlled level where somebody can manage with just diet and with minimal drugs, or some with just diet and lifestyle changes. We are very grateful. The funds have added a lot to our facility, and many inventions have been born out of that. For one, when we did the outreach program, we were able to reach out to the community around, and initially we had a situation where the community around do not come to seek service delivery in our facility, but reaching out to them, we have seen the improvement. They are able to come for not only the NCD, but even for other illnesses. So reaching out to them was a positive mark through the help of the HASK funding. Then we've also seen the total turnout of patients. There's an improvement. There is more than that, because we've had many volunteers, doctors coming on board to assist due to the outreaches which we have had, and which has had a positive impact in management of the patient. They have also, out of this, we have had new linkages through the facilities where the services which we do not have in our facility, we have had to outsource through partnership and linkages with other facilities like German Center for the imaging and Ilala for the lab works. So we are grateful that it has opened doors of untapped resources that we didn't realize were at our reach. And also the trainings have had an impact to ourselves, to the staff, and we find a very well motivated staff initiative and ownership to the facility. Number of challenges we faced was, one, we had a gap because we didn't have by then among the staff a doctor, qualified medical doctor. So for us, with the clinician, we thought we could just refer, but we are grateful that we have had somebody on board who can come and review and give a secondary opinion or change their treatment styles and their regimens, and we are happy for that. Then the other challenges we got is that this area has a lot of poverty and also illiteracy levels, they are high. So majority of the clients who we have realized, they are people who maybe were diagnosed long back, but they declined the treatment due to the high cost of the treatment and the disease burden, because they are not able to, like on the nutrition part, they are not able even to afford a meal for themselves. So having brought them on board and realizing these challenges, we were able to address them to some extent, because we are able to subsidize their medications, the prices of their medication. And more than that, with a regular meeting every month, we are able to identify how far have they reached in this gap of their treatment and their food stuff. My word is gratitude to each one of them, to every person in HASK project and to the donors. because with the little that we have been able to be given, it has impacted a great progress in the facility. It is the one which has brought the birth of the inpatient for us, and then also the capacity to know that we had a nutritionist who we could use to give advice and to give the nutritional support to our clients and to the people in the community around, as per before we just used her as a patient attendant. We've also realized that through this we have had more partnership and linkages which have a positive impact to the service delivery in the facility, and also the positive impact on our staff, because they feel motivated when they can see the results of their inputs. So we are able to, even the facility is well informed, because we are able to look at the statistics, the challenges, and we are able to see a way forward.